government is urging South Africans to get vaccinated or get COVID-19 booster shots ahead of winter. Health Minister Joe Phaahla says people have stopped vaccinating and that government is now sitting with over 25 million doses. The African Health Institute's Professor Thumbi Ndung'u joins us to discuss this further. Professor, very good evening to you. Thank you so much for being on News at Prime. So, do you think people will heed calls such as that of the South African government when you consider the overall decline in levels of vaccination since the lifting especially of COVID-19 curbs unrelated, or in fact related to COVID, but that aren't exactly vaccination?
Well, thank you very much, Thumbi, for having me on your show, and good evening to the listeners and as well. Yeah, I think that the South African government and the minister are on the spot here and correct to ask people to take booster vaccines because COVID-19, although the threat of massive numbers of deaths from the infection have pretty much disappeared, the infection is still with us and people are still getting infected. And particularly for vulnerable people, some end up with dying from the infection. In fact, in some countries that are keeping good records of this, we still have thousands of people that die from COVID every week. Mm-hmm. So I do think that the threat, even though it has dissipated somewhat, has not completely disappeared. And so I think the minister is right in urging people to get booster vaccinations, particularly when you consider that the infection doesn't, or rather the vaccination doesn't completely protect people from getting the virus, and also the immunity wanes with time, so that people become much more vulnerable at a later time point.
But conditions are different, aren't they? As I was saying earlier, initially when the first batch of vaccines arrived in South Africa, people wanted to get vaccinated, A, because many feared for their lives, because we didn't know much about COVID-19. Many wanted to get to a point where the non-surgical interventions, I think they were called at the time, were, no longer a requirement for daily life. Now that both of those things have basically faded, shall we say, from public memory, do you think that the public has lost sight of the importance of vaccination? And if so, how then do we get, especially the vulnerable groups, to get the boosters? How do we encourage them?
Yeah, I think you're right. I think the situation has changed significantly since the beginning of the pandemic, and that's primarily because a lot of people got infected or got vaccinated, and so that boosted the immunity within the general population. But as I mentioned, the infection has not completely disappeared. So although the situation has significantly improved and people are able to go back to their way of life, I think there is still significant threat of the virus, particularly in the vulnerable population. So I think that perhaps what the government needs to think about is how to message, change the messaging around COVID, so that people can come out in larger numbers than what we are seeing. I think that the perception in the general public at the moment is that this infection is completely gone and that there's nothing to worry about, and I don't think that that's correct. I think that among these vulnerable people, the infection is still there. And so I think we need to devise ways to encourage those people and perhaps target it better at those vulnerable people so that they can get vaccinated and protect themselves.
And the internet is still filled with conspiracy theorists, or whatever you may choose to call them, people who say, well, I wasn't vaccinated, nothing's happened to me, I didn't die, you were sold a false message by the various governments of the world. People who say that, people now in some cases are dying suddenly because they took the vaccine, even if that is an unproven or untested claim. How do governments then begin to counter that sort of messaging, especially among people who have conditions that predispose them to serious illness? And as you say, people are still dying, perhaps not in their hundreds and thousands, but they're dying nonetheless.
I think that the problem that the government and the entire healthcare workforce has to deal with is the issue of misinformation, which has become very widespread because of the availability, particularly of the internet, and the spread of misinformation and disinformation on the internet. So, for example, you find that although it is true that the vaccine does have some side effects, and that a few people, one perhaps in 6 million, for example, can get severe consequences from getting the vaccine. The message of the positive impact of the virus needs to come out much more. And I think the other problem that we're dealing with is the fact that prior to COVID-19, people are used to having a vaccine that completely protects against infection. And now we're having to deal with a vaccine that doesn't protect against infection. So you can still get infected. It's only that you don't end up with severe consequences such as death. And so I think we need to adjust our messaging to make sure that people understand that you have a vaccine that is actually very, very effective in preventing serious health consequences such as death, but it doesn't completely protect you from getting infected. And I think that message needs to come out clearly, particularly among the vulnerable people. And so I think that health educators within the ministry need to come up with new ways of messaging to counter the disinformation, but also to provide the public with the information about this vaccine and how it works and how it might protect them from severe consequences as opposed to just protecting from infection.
Professor Thumbi Ndung'u, thank you so much for your time tonight.